This week on Coronavirus Explained, we're discussing social distancing. Keeping away from other people when out in public has become part of our daily lives, but there's no exact rule as to what the distance should be, and the guidelines vary from country to country. The UK government announced this week that the 2-metre rule will be reduced to 1 metre plus in England from the 4th of July. That leaves Canada, the only country sticking with 2 metres. In the US, it's 1.8 metres, which is more or less 6 feet. Many European countries like Germany, Spain, Italy, also Australia require a 1.5 metre gap. In South Korea, it's even lower at just 1.4. While China, France, Denmark, Singapore and the World Health Organization all advise keeping at least 1 metre distance. So what does the science say, and to what extent are social distancing guidelines ultimately decided by political and economic factors? To discuss this further, I'm joined by Dr. Zeshan Qureshi, who has led a review into social distancing for the Centre for Evidence-Based Medicine. And from Denmark, we can speak to Professor Eskild Petersen, an expert on infectious diseases. Good to see you both. Dr. Qureshi, why is there no scientific consensus on this?
Well, it's a really, really difficult thing to study, and we also have a new virus that's behaving in a different way to what we've seen before. What we do know, though, is that there's lots of evidence emerging for this coronavirus, and we also have more and more up-to-date information on how droplets spread. The origin of 1 to 2 metres for social distancing is, in fact, quite historic. It's related to research studies decades and decades old about how far droplets are spread, and to a certain extent previous infections. What we do now from the research that we've done so far is that, broadly speaking, more social distancing reduces risk, and that when you do reduce from 2 metres to 1 metre, you are definitely putting a nation at risk of a second peak and more infections coming about.
So, Dr. Qureshi, can these droplets spread more than 2 metres?
When you look at studies which analyse coughs and sneezes and the smaller droplets that go further forwards, actually it's not 2 metres, it's not 3 metres, but it's up to 6 to 8 metres in human subjects that droplets have been captured. Now, whether those droplets carry coronavirus and coronavirus that is significant enough to cause infection is unclear, but some of the research that we saw where we looked at outbreaks showed that, for example, in a restaurant in China, when all the interactions between people were captured on video, there were individuals up to 4 metres away from an index patient that still caught the bug. So social distancing is not a magic bullet, even at 2 metres, and we all have to be extra aware of the fact that we might be passing on an infection.
So, Professor Petersen, given all of the different elements involved and the effect of social distancing on things like the economy, what do you believe the right distance is to follow?
I think that this is not only about science. This is a communication tool to the public, how you would deal with the outbreak. And as Dr. Qureshi said in his paper, the social distancing or physical distancing is to be seen in the context of other measurements also, like we are closing public transport, closing the airports and all that. So 2 meter is, what shall I say, it's an average which most countries choose to start with. For instance, in Denmark, we started with 2 meters, and when we opened primary schools the 15th of April, we kept the 2 meters by splitting classes into 2 and only opening classes for children from grade 4 and downwards. When we needed to open school classes for the older age groups, we had to use all the rooms in the school, so we reduced it to 1 meter so we could keep a whole grade 4 into a single room, and that is so of course 1 meter gives you a higher risk than 2 meters, and 2 meters is still not giving you 100% protection. But if you can see that the risk in society is going down, then 1 meter allows you to open schools, open restaurants, and it is so important that our normal life is getting back, even though there will still be a low risk.
And Professor Petersen, when you reduced it from 2 metres to 1 metre in Denmark, did you see a spike or a rise in infections?
No.
So there's an answer there, Dr. Qureshi. How does social distancing fit in terms of some of the other factors? Like, I'm thinking of things like the time of exposure that you have to it, the viral load, wearing a face mask. Where do you put it in terms of ranking those things?
I think social distancing has to be done in context. If you are outdoors, if you aren't speaking very much, if there aren't many people around, and if you have a short exposure time to that environment, even like 1 meter might not really be necessary. But if you're in a crowded indoor environment with poor ventilation and people are shouting or speaking very loudly, like in a pub, in our paper we said very much 2 meters even might not be enough. It's part of a package, and the reality of the evidence is we don't really have clear-cut data on what is most important and what the rankings are. And one of the challenges I have with what Boris Johnson has said is that he said that this 1 meter plus, i.e. where you have 1 meter of social distancing plus additional factors like face masks, good ventilation, is equivalent to 2 meters. But I haven't seen that science, and I'm very much looking forward to it coming out so that we can scrutinise it and see actually what level of risk we're really taking by this reduction. Professor
Peterson, very briefly, you mentioned trust. Where do you think there's been a high level of trust between government and people over this issue?
I think that one of the countries that done a very good job in Europe is Greece, and I think that is because there has been a general trust between the public health professionals and the politicians. I'm not sure I agree with Dr. Qureshi that we are needing a lot of science here. This is common sense, it's politics and it's science, but we have a new epidemic, a new virus behaving differently. So there's a lot of common sense, a lot of drawing.
I'm afraid that gentlemen, we have to leave it there, but thank you both very much for joining us here on BBC World News. Thank you.
Thank you.